watching Morning at NTV.
My pen is ready and my paper is ready as we have conversations in Take Note this morning. Health crisis impacting our social behaviors. My name is Priscilla Regina Naloga. Thank you so much for being with us on Morning at NTV. Now, the rapture of COVID as a pandemic and now Ebola as an epidemic have completely changed the mode of life and drifted social behaviors. But as seemingly they are weakening, the danger isn't gone yet, and we do have the Ministry of Health here to expound on exactly what is on ground and how we are tackling this to make sure that Christmas can find us well to do as far as the health sector is concerned. I'm joined by the Public Health Director from the Ministry of Health, and that is Daniel Chabayinzi. You're most welcome, Daniel.
Thank you, Priscilla. Thank you for having me. We've been all disrupted with the way we behave. The pandemic, COVID-19, which is all over the world, Ebola epidemic locally in Uganda has changed the way we behave, has changed the way we communicate, has changed the way we sit.
That's true.
The way we dress. Now I have the mask, but remain people. That just as we think Ebola and COVID are here, there are measures we can do to help us prevent that spreading.
Okay.
So it has completely changed the way we behave as people. Could
you highlight for us those significant social behavior changes that have occurred with the two?
One of the significant one was the health promotion agenda. Everybody is talking health and health keeping us healthy, not with the medication. So we've also now moved away from medicalization of all health interventions to knowing that we have social approaches. Communication has become a tool in the fight of epidemics. Behavior change, engagement on one-on-one to tell people this we can do, this we shouldn't do. And once you listen, these are the benefits. For instance, hand washing, which we talked about for many ages, just having clean hands.
Right from school, actually.
Yes. P1, P2, everybody knows hand hygiene, but now it has become a norm for everybody. Even if people have not fully adopted it, their belief and understanding that clean hands can keep us safe is a major shift.
Okay, I have tested the clean hands. Every time I get an opportunity to wash my hands, I realize how dirty they are, even though you never get to see the dirt. Now, speaking of what we never get to see, in regards to the fight against the pandemic that is still here and now the Ebola epidemic, what is the Ministry of Health's contribution to the fight against these two concurrently?
Well, our ministries is to set the agenda. What is the policy framework in which we are going to respond? So I'll talk in terms of what guidance we give to the rest of the people who we work with, the health workers who are frontline health workers. We give guidance, we give resources, we allocate tasks, and then we track how we are performing. And then we give feedback to the rest of the community. So our key elements is, first of all, if we have failed to detect the pandemic or epidemic before it happens, then we prepare for response. As we prepare for response, we put logistics, we put pillars, we put responders, we put the tools, we put the infrastructure. We now also give the skills of the people who are going to respond. And then finally, when the worst case scenario happened as it happened, then we go into the services of keeping those who are affected in treatment, and then those who are not yet infected or affected safe from getting the infection. So we do a number of things. We devise methods of how to keep the whole population safe. Okay. Some of them are restrictive, others are promotive, but others can be also cautionary when we do non-medical interventions.
Okay, all right. The bigger question would be for me right now is that for COVID-19, we understand it was a global, unexpected, but we do have Ebola that has been recurring here in Uganda over and over again. Why is our country susceptible to virus attacks, and what can be done to actually prevent it for the next future?
It's quite puzzling. You know, the Pearl of Africa is a Pearl of Africa for everything.
So disease inclusive?
Disease is inclusive. Our environment is so conducive for everything to live and grow, first of all. So talk about the viruses. Some of them are in animals which enjoy the fruits around us, fruit vegetation, the bats, the primates, the chimpanzees, the gorillas. These can keep the viruses, because the diseases we're talking about now are zoonotic. They come from animals to people. And then the way we eat, the way we interact with the environment. it's very possible for somebody to go and hunt and eat what wouldn't have eaten before. And once that step is breached and the virus has moved from animals to the human race, then we get into the problem of the way we interact as Africans. We are homely people. We are relational. So the way we relate, the way we care for each other, exposes us to whatever you get, I get. We are better when we hug, when we kiss, when we handle and play together. So the transmission, we give the disease chance to circulate among us. And then the way we seek care, we first of all think ourselves as spiritual people in a body. So anything which happens to us, we want to have a spiritual intervention. So that's how it happens.
Go to the witch doctor.
We go to the traditional doctors before we come to the physician like myself. Before we seek physical help, we want to get mental
But also
help.
we're waiting for the part where we are so consumed by the disease, weakened by the disease, in order to seek medical intervention for that.
And it also happens that previously we've been treating ourselves in our homes. We get a few herbs, we concoct, we milk, we shake, we swallow, and we're okay. Now there's some things which don't go away by just doing that.
Okay.
So we get to live with ourselves, but we progressively move to find that what we're doing at times is not.
So Daniel, we see these social behaviors having interrupted the fight against Ebola particularly. You've talked about the traditional healers that have caused the numbers of deaths to go up. We have seen people who have the custom of we must bury our own, so they go exhume the body of an Ebola victim and then they rebury it, which has led to other contacts then getting Ebola. And so I guess how do we change the social behaviors in our society right now? Because clearly they're the ones that are aiding the harboring of these viruses within our communities and our countries. So how can we revert this and then be able to deal away with these epidemics once and for all?
Thank you very much, Priscilla. I appreciate that some of the dynamics are new. Our cultural practices are cultural practices. If that's how we've been dealing with our sick people, we have to continue dealing. What happens is that we are now being primed to be so active the moment something changes, and people should be tuned to change. Now, once there's an outbreak and we tell you, please stop visiting A and B and C, come right to this health facility. Meaning we have to prepare the health facilities to be attractive for the people to trust that once you tell us to come, we shall find the services you're saying are there. We shall get the care that we expect, and we will not be shocked in the kind of amenities that are there. Some of people are coming, you're coming to a setting where there is piped water, where there is plumbing and toileting. You need to prepare me that when I come to the hospital, I have to shed a few of the things I'm exposed to. I'm coming to a different environment. The kind of colors you put in our hospitals can be frightening or inviting for me. Now, people have always been seeking care from certain places. We need to tell them, don't. We have an outbreak. We've sounded a gong. We have Ebola. This is how it spreads. Believe us when we say stop. We've been burying our dead, preparing some rituals. So suddenly, we cannot do it. So that means, even if we are going to stop doing it, let's give a dignified burial where everybody feels we did not do our cultural practice, but whoever is helping us do the burial has done exactly what we expect, or has explained why it cannot be done. So we are building a network of understanding with our community because we are part of them. We also have fears, we also have aspirations. If for the last 30 years I've been working to go to heaven, why should somebody try to ruin my final departure by not doing just one simple step? Just prepare me to say, yes, that will also happen. Let's do it together. Understand that this is a different context. And that way, we can able to work. And you see, one activity or one incident exposes all our knowledge, and that one bad example becomes a good example. I say it's a bad example, but it becomes a good learning experience to the rest of how we shall deal with things. So our community, our people, we are all in the progress of learning. Okay.
All right. In the progress of COVID-19, we should be having vaccination drives. The Ministry of Health has taken quite silence to communication as a tool in the continuous adaptation of vaccination in order to continuously control COVID-19, because China right now is grappling with lockdown after lockdown because of they're trying to have zero pandemic, zero COVID-19. So where we stand right now, tell us in terms of accessibility to the vaccines, are people easily getting those vaccines right now, and then how is it being dispensed in terms of communication to rally people to continue on with the vaccination drives?
I have both good and bad news.
Do tell.
The good news, so far we've vaccinated close to 26.8 million doses. So 82% of all the people, adults you see in Kampala above 18 years, have all at least received the jab. So they know it works, so they have accepted to take that. So we've broken the initial hesitancy. We started preparing to vaccinate those between 12 and 18. Our timing was not right. The people were in school. When they came home, we had poor communication and poor information circulating against our interventions. So we have not done well. In that group, we've only vaccinated about 12%. So nationally, we are not doing as well as we've done in the adults. But the key people are the elderly. Anybody above 50 years who's not received a vaccine for COVID is in great danger. I want to appeal to you. If you have anybody older than that who has never received the jab, should encourage them to go and get vaccinated. You are asking me what are our preparations. We have people who have partnered with us, partners, to share the information, to lead in tracking what we are doing. We have Amref, which has been helping us. I know there are some good donors like the UK government, the USA, the UNICEFs of this world have been helping us to share the informations.
Okay. Moving forward, in your final words, how do we go? Shall we have Christmas normally, or?
Christmas comes every year. We shall have Christmas this year. However, if we don't adapt to the changing environment, then we shall have a disrupted Christmas season. However, we are hoping and praying with God's blessing that we shall have a quiet Christmas. The number of Ebola cases have come drastically down. The numbers are not spiking continuously. We had spent almost 2 weeks without a single case, without a single mortality. We have only 6 people in admissions in all the hospitals we prepared. We have just less than 100 people on follow-up. So it's becoming quiet, and we are looking anxiously, but also very, very, very upbeat for the kind of Christmas we are looking out to.
Okay. All right. Thank you so much, Daniel, who is the Director of Public Health in the Ministry of Health. And he has given us the confidence that we shall have close to normalcy when it comes to Christmas time. Of course, as you know, the districts of Kasand and Mubende, they're doing everything possible with the lockdown to ensure that they bring those numbers down. And with the report that he has shared with us, they've not registered a single contract as well as death for that matter. That gives us hope that we are doing things the right way. And let's continue doing things the right way. Again, the social behaviors that he talked about, let's continue to adapt them so that we can prevent these epidemics and perhaps a pandemic in the near future. That brings us to the close of our morning at NTV edition. On behalf of Chris Higenyi and myself, Priscilla Regina Naloga, have a winning day.